Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the first video of rapid revision course of community dentistry, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about level of prevention of disease, which is 3 level: primary level, secondary level and tertiary level. This video is important because in last NLE March exam most of the MCQs was come from this topic, level of prevention. Now level of prevention are come in dental health education. And what are the objective of dental health education? The objective of the dental health education is to influence the attitude and behavior of individual to maintain oral health for life and prevent oral disease. This is the objective of dental health education, to influence the attitude and behavior of individual to maintain oral health for life, and second objective is the prevent oral diseases. Now in prevention of oral diseases there are 3 level of preventions: primary prevention, secondary prevention and tertiary prevention. In primary prevention there is a prevention of initial occurrence of the disease. Before occurrence of the disease we prevent. This is primary prevention. In secondary prevention our aim is to in secondary prevention the disease is present. In primary prevention we there is no disease but we prevent the occurrence of disease. In order to there is no disease. But in secondary prevention, disease is present, but we limit the progression of disease at early stage as possible after an onset. In tertiary prevention, also the disease is present, but disease also develop complication, and we prevent further complication. This is the tertiary prevention. Now, first is the primary prevention. In primary prevention seeks to prevent the initial occurrence of a disease or disorder and is aimed at healthy individuals. Our aim is healthy individuals. Protect individual against disease, often by placing barrier between the etiological agent and host, because we place barrier between etiological agent and host. Now these are very important. In primary prevention, what are the methods come in primary prevention? Because they give in MCQs, oral hygiene instruction are come in primary prevention, secondary, tertiary. Our answer will be primary. Now in primary prevention there is a method of prevention include dental health education, oral hygiene instruction, because we give oral hygiene instruction in order to there is no caries or periodontal disease. Next is the use of fluoride, topical or systematic, again come in primary prevention. Diet and sugar advice, providing sugar substitute like xylitol. Next, sugar free chewing gum. Next is the fits and fissure sealant, they also come in primary prevention. Our aim is to prevent caries. Next is the plaque control, use of mouth rinse and effective toothbrushing. These all the procedures are come in primary prevention, and for MCQ's point you should remember all these procedure name like dental health education, oral hygiene instruction, use of fluoride. You should remember each one name. Now come to the secondary prevention. In secondary prevention our aim is to limit progression and effect of disease at early stage as possible after onset, because disease is onset is already occur. Now in secondary prevention we do a bite wing radiograph, then essential adjunct to a patient. First clinical examination, mean clinical examination, radiograph, composite and amalgam restoration and re-restoration. These are all procedure which come in secondary prevention. Remember, radiograph, clinical examination, composite and amalgam restoration, re-restoration, these are come in secondary prevention. Now come to the tertiary prevention. In tertiary prevention help individual to deal with the effect of disease, because effect is already present. Now we help individual to deal with the effect of disease and to prevent further reoccurrence. At this stage, the disease process will have extended to the point where patient health status has changed and will not return to the pre-disease state, trying limiting the extent of disability once disease has cause some functional limitation, because we prevent the further complication which caused by disease. Now in tertiary prevention, like root canal treatment are come in tertiary prevention, because if pulpal disease cause periodontal disease like abscess, they will involve the bone, there will be swelling, and to prevent further complication we do root canal treatment. Now in this whole topics, you should remember the name which procedure come in primary prevention, like oral hygiene instruction, fluoride, toothbrush, mouth rinses, chewing gum with temperature sealant, dietary advice. These are come in primary prevention. Radiograph, clinical examination, composite and amalgam restoration, re-restoration are come in secondary prevention. In tertiary prevention, like root canal treatment. This is all about level of prevention. Now if you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.